Good morning, everyone.
Good
My
morning.
name is Consolata Kabonesa from the School of Women and Gender Studies. Thank you.
Welcome, Professor Grace, Professor Consolata. Anybody not yet introduced?
Morning, ladies and gentlemen. I am Nelwega Hajara from the Ministry of Gender, Labour and Social Development.
You're welcome.
Have we exhausted?
Morning. Do you want to sit here with Grace?
Good morning, everyone. My name is Nsanja Godfrey. I'm a senior statistician working with Uganda Bureau of Statistics in the Directorate of Economic Statistics. Thank you.
You're welcome.
Doctor, I think we have exhausted the introduction.
Thank you very much. And those probably who are coming later will introduce themselves as we go. I'm now comforted that we have the right team in this room. Thank you very much for those introductions, all of you in your respective capacities, from government, from UN agencies, from religious institutions. We're glad we have actually the Interreligious Council. So in a way, all the major faiths are represented from the different activist groups, researchers, development actors. I think we are now very much set, and all our speakers are in the room, and I are privileged to be here. Today, we are disseminating baseline results for a project, from promises to action, shifting gender norms and public perceptions about unpaid care work. And, we want to dig deep into this. This is a project that has been ongoing, as you'll hear from the various speakers, the aim of it, and so on. And I'd like to begin understanding what are some of the issues that are coming up from the baseline. I would like, without taking much time, we are a little bit behind, about 10 minutes, to invite Associate Professor Consolata Kabonesa, standing in for the Dean, School of Women and Gender Studies, Associate Professor Sarah Sally, to welcome us here at this occasion, and then that will be followed by some remarks from the development partner in this, and then proceed with the program. Associate Professor, you're welcome.
Thank you so much, Dr. Madanda. Good morning again. All protocol observed. I believe we have government representatives here, EPRC representatives, Honorable Member of Parliament, Florence Asimwe. Doctor, you are most welcome, and we recognize your presence. Other development partners, representatives from UN Women, the PI and your team, the media, ladies and gentlemen. I have the pleasure to welcome you this morning to this very important function to disseminate research findings from promises to actions. There are promises, so many promises, but how do we move from those promises to actions? And that's what we are going to hear today. And in order to do that, we are going to be able to shift gender norms. Now, shifting gender norms requires that we get to understand what the public thinks about unpaid care work in workplaces, in families, in communities, in Uganda. So that is our research for today. And as we know, women and girls contribute so much to the economy. But we also know that although they contribute so much, their services are normally not recognized, whether be it in the household or be it in the community. Why? Because we already saw within the title itself, it says unpaid care work. And unpaid care work, because it is not monetized, there is no money value to it, we claim we cannot know what value it has. But we know that the services of women have greatly improved and increased during the pandemic into COVID-2019. And now when we add on the war in Russia and Ukraine, that one has also increased what women are expected to provide in the families. And we know that sometime back, in 2015, which is sometime really back, UNDP came up with a study and they said that women contribute 3 times more than men in the unpaid care work. And that is quite a lot. But we know it, because if we think hard on it, we can be able to understand that yes, women do that. But unfortunately, in most cases, we don't think about it. We cannot blame the men because they don't think about it. And if they are given a chance to think about it, they definitely see that their women are doing and are expected to do too much in the household. And once they find out, they are ready to help their partners. Again, women's contribution is not really understood by policymakers, because as we said, there is no money attached to it. So if it is invisible to them, they cannot have proper policies to address their issues. Legislators, it is also the same. And we have our Honorable Member of Parliament here. She will tell us also it is like that. But also some of us researchers, we don't bother to dig deep to find out what is it that these women are doing. How is it helping them? How is it helping the economy? And how is it constraining their empowerment? So, since the care economy is not taken in financial matters, it is undervalued, and the responsibility of it, as we said, is left only to women. And that actually gives the women a heavy workload. And that heavy workload and the time they invest in has implications. For the girl child, has implications on her education. We know very well that when girls leave school and go home, they go to do housework. They go to look for water, look firewood. And so that has implications on whether they are able to continue with their education or perform very well in education and continue. But it also has implication for women as far as employment is concerned. If a woman has a number of children at home and has to look after the sick or the elderly, they will find no time to look for part-time employment to get some kind of cash. But it also means that they don't have the time to engage with with civil society organizations. And if they don't, they miss out on information. They cannot get information. Or even engaging with their fellow community members, because that's where they can get information. It also has implications on their leisure. Ladies and gentlemen, for women to be healthy and to be productive, they need leisure. They need some time to rest. But in some cases, a woman will wake up very early in the morning at 5 o'clock. Up to 11 o'clock, they are still going. They are still having work to do in the household. And that in itself leads to poor health, it leads to disempowerment, and other barriers, as we know. So that means they cannot participate in the economy, they cannot participate in politics, because it is very important that women, girls, and the youth get engaged in political participation. But in also their roles within the family, within the community, are also constrained, particularly the one of decision making. And so when we have women are having that unequal share of the unpaid work, they take the sole responsibility. It requires us to look at the gender roles, to look at the social norms, and to see what is it that we can be able to do. And SDG 5 is about valuing and recognizing work. So we need to ask ourselves, how do we do that? And we demand for greater understanding of how we can be able to relieve the women's burden, to promote their equitable participation in the care economy, and also to have their work valued. So we ask ourselves, how can governments and development partners address families and communities' needs or reduce women's workload unless investigations of this kind in the communities of women's experiences are documented, unless their voices are recorded to inform policy and to ensure that they are socially included, and the practitioners and trainers and instructors have the knowledge and skills to address them, we cannot be able to address the issues of women. So therefore, I wish to thank the team, the PI and her team, the researchers, and our collaborators, EPRC, and our funders, because without them, we could not be able to do so. So thank you very much, and I thank you again, and the School of Women, we are ready to partner with you at any time. Thank you.
Thank you very much, Professor, for those very, very wonderful remarks. At least we are beginning to hear the care economy, which is not recognized, which is not researched, which is not documented, and therefore that creates problems for those who want to do interventions. Allow me to welcome you who came after we had made introductions, and also to recognize our Honorable Member of Parliament who is here with us, Honorable Florence Asimwe, the Woman MP for Masindi District, former academician, activist, and welcome. We've been saying that, you know, the policymakers have not heard. Now that you are here, I think now we are assured that you have heard. And so our message is being delivered straight. We will take the first bit of this morning to do the welcomes, the remarks. And let me therefore take this opportunity again to welcome Professor Dr. Annette Mlema, the Senior Program Officer, EPRC, those who are putting in coins to give us some few remarks. What is this animal called GROW and all that? And Doctor, you're welcome. Join me to welcome Doctor.
I already feel welcome, so. Is it on? Yeah. Anyway, thank you so much. All protocols observed. You can hear me, I guess. Okay, this is better. It's about the positioning, I think. Yeah, I'm so pleased to be here, and I thank my colleagues for giving me the opportunity to come and say a few things about GROW in this forum. Quite impressive representation with the diverse audience that we have here. I'm more than confident that we are ready to shift. Shift from where? From promises to action. I think it's a commitment that we can make in this forum. So I've been introduced. I work for EPRC. I'm based in Nairobi. And I should also say that I coordinate a cohort of 11 projects under this GROW initiative, which in full is the growth and economic opportunities for women in East Africa. And I do this work together with my colleague Melissa Martha, who is not here with us. She's based in Ottawa. So I can't go without mentioning her name because it's a team effort. So I'd like to also thank the entire team that is working closely with all the partners here to make sure that we advance the agenda on women's economic empowerment. So as my professor mentioned, she has said it all. So I don't think I'll iterate what she has said. But from the donor perspective, I'll just say something about GROW. What is this animal? Because she has highlighted the challenges that we all experienced in getting women's unpaid care work addressed. And I'll just say something about how we are doing it as EPRC together with our partners. So GROW is an initiative that is jointly funded by the International Development Research Center, the Gates Foundation, and Hewlett Foundation. And it's kind of it builds on the first phase of the GROW initiative. Because it was a multi-funder and successful, this GROW initiative builds on all the successes that they generated, but focusing on East Africa to have more kind of a delving into these issues deeper on a small scale, but deeply. So what are the objectives of this initiative? Professor has already spoken about the contribution of all the actors we have in this room on this agenda. And as GROW, our mandate is to make sure that we generate quality evidence. Evidence that will address the barriers and promote quality work for women and girls in East Africa. And we also try to ensure that this evidence we generate does not sit on the shelves, but is actually applied by practitioners, but also policymakers to guide their actions. And I'm glad that at least we have a representation of policy actors. So we also try to promote local research leadership, making sure that our research is grounded within the local context, led by local researchers, building their capacities to diagnose gender issues and come up with context-specific solutions. So our priorities as GROW are two-themed. So this is one of the themes that we have, which is actually it has attracted a lot of attention across the globe. And this is work on reducing and redistributing unpaid care work. And our effort is really to test solutions that we reduce this unpaid care burden. And here we have work or projects that are testing solutions to childcare provisions. And we also have projects that are testing solutions to shift culture norms, and this is one of them. And the other key theme for us is tackling labor market segregation. So we have projects that are testing solutions to enhance the skills of young girls to help them get into more lucrative employment. And we're also testing solutions to increase women's participation in government procurement programs. So we have a cohort of 11 projects across East Africa, in Rwanda, Uganda, Ethiopia, Kenya, and Tanzania. And all these are basically action research or evaluative research projects. So we are testing solutions, what works where, when, and how, and for who. And these solutions are supposed to be kind of inform policy, but also programs. So besides that, in this endeavor, we also do systematic reviews to make sure that we pull all the evidence together. Most of our evidence is siloed. So our work is to make sure that we bring it together, we collect it so that it's digestible for our policy actors. And we also support our projects to engage with policymakers on an ongoing basis. And this is done mostly through the opportunity grants that we give out to these projects. So for us, success is in terms of the policies that we have informed or influenced. We would like to see a shift in policies that are informed by our evidence. So all the implementers in this room, I'm hopeful that the evidence that will be presented by our colleagues will be embraced, and we'll try to figure out how best we can apply that evidence in the work we do. So without any further ado, I think I'll leave it at this, but we are so pleased to be here and to be supporting this kind of work to really make sure that we empower our women and girls to have a better livelihood. Thank you very much, and over to you.
Thank you very much. We have heard from the EPRC itself, represented by our own Dr. Annette here. Thank you very much, Annette, for showing us that, as practitioners, those of you who are in practice, you know that the issue of evidence around these issues is quite challenging, and that forces some of us to program everything in the hope that we shall do something. And so you put in all these things. So looking forward to really seeing what works with evidence, I think, is what all of us in this room are looking forward to. We will have one more conversation led by Professor Grace Bantebia. Professor Grace Bantebia is the principal investigator or the principal researcher for this project, which Annette has said must be locally read in terms of generating evidence. So within our national context, Professor Grace Bantebia, who is a professor at the School of Women and Gender Studies, but also the head of grants and administration and, at Makerere University, is here with us to take us through a few remarks around this project. From the overarching picture provided by Annette, what is it that we are dealing with it here nationally? Professor Grace, you're welcome. Thank you for welcoming Grace, more than that. Thank you so much.
COVID is still with us, and so that's why I'm sanitizing this. Yeah, good morning. Yeah, we are super excited to have all of you around as we share with you the baseline findings. I would like to recognize, many of us have already been recognized, but allow me to recognize a few people who are here, who are also here. I don't know if who is going to run the slides? Should I go that side? First of all, our honorable member, Honorable Florence Asimwe, Woman MP Masin District. She's also the chairperson of our project steering committee. And at this moment, I would also like to recognize other members of the steering committee. Please stand up for recognition. Haj, very, very who has been with us all through. He never misses our meetings. And if there are others, also please, I recognize you. Some of them could not be here with us. Annette, we're happy to see you today. We've been communicating online, on Zoom and so on, but today we see you physically. And so which one? This is next. Yeah, thank you. Yeah, and the team member, I mean the other members, civil society, the development partners, colleagues, and friends. I'm just going to, first of all, so introduce the team. The team, please, can you please stand up for recognition? This is the team that has been working so hard from Makerere. This is a consortium of Makerere University, EPRC, and CARE International Uganda. So that's the team that has been working behind the scenes, who have been cooking, and you're going to hear the findings that that are going to be presented today on our project. I know many times we forget some people, but please, all of you who are seated here, you are recognized and appreciated. Officials from the ministry, the cultural leaders, funders, the media. The media is very, very important for promoting the areas that we are working in, and ladies and gentlemen. So you are all appreciated, and we are super, super happy that you are here with us. I would also recognize there are quite a number of people who are online. This is a blended meeting. We have a number of people who are online, so we recognize you too as you listen in. I'm going to give a brief about this project and its origins, and I think Annette has briefly said some of the issues that we are dealing with. And some of the issues have also been mentioned by Professor Kabonesa. As she said, that in Uganda, women and girls spend more hours on unpaid care than the men. So that was one of our motivation, and trying to understand, especially the gender norms that are key in driving the persistence of unpaid care work in our country. We also observed, as Professor has observed, that COVID actually revealed to us much more stronger dynamics and situation by increasing the burden of women, and it revealed many underlying issues, norms, and beliefs and practices around unpaid care. We are also very cautious and thank the government that there is a national development plan really which seeks to expand women's participation in paid work. But we know, and we knew, that this paid work may not be really beneficial to women when the very government program is silent on unpaid care work. So we believe that addressing the heavy burden of unpaid care work will ensure that women are able to engage and take up the opportunities in paid care work. So that is the motive, that's the background why we thought and we proposed this project. Those are the objectives that we drew up and would want to consider. I will only explore the main ones, which is in green, really shift, from promises, the interventions of and scale up promising interventions, which you will quickly listen to, using the power model for shifting the gender and social norms and public perceptions. Recently, we were in a meeting, and the discussion about the power of perceptions about unpaid care work was so heavy and so strong that it defines, those perceptions are defining who women are and who men are. and there is need in a holistic manner to address them. We seek to use a power model which has been tested before. It has been tested on gender-based violence. We seek now to apply it to unpaid care work. And so there are some modifications that we are trying out as we hear in the next presentation, our baseline, to see if these components of power, as you see them on the board, are able, or a combination of them, are able to address the issue we are talking about today, which is shifting, which leads to recognition, redistribution, representation, and reduction of unpaid care work in order to release women to enjoy the opportunities offered in paid employment. We took that approach of the model, but also a randomized control trial to test the key aspects of the power model that have potential to change and shift the norms. We had 4 phases of the study, which we proposed: formative, baseline, intervention, and endline. In between, we have other areas that we are working with, that we are addressing as we implement the project. Those are the interventions that are based on the power model. And in the next presentation, we'll also hear what exactly we have crafted for the actual intervention. The first area that we are looking at, a combination, is the entire model, which is including promoting women's economic empowerment through VCLS as a component, organizing and engaging men and men and boys as another component, and also working with communities. We took this project using an ecosystem kind of approach, that everyone counts in this system. The individuals, the families, the boys, the men, the communities, and all the other significant other players, like religious leaders, cultural leaders, as key actors, they are all being targeted. So it is this combination of things that we are trying out as researchers. And at the end of the day, we want to see which combination makes a lot of difference in shifting the norms, in addressing the perceptions around unpaid care, which we significantly know are very, very instrumental in driving in the persistence of unpaid care, how it is today and how it has been for a long time. Those are the districts where we are operating. I don't want to go through how we selected them, but believe me, as academicians and a randomized control trial, we have to have a clear method of selecting these districts. So there are 4: Mbarara, Masindi, Palisa, and Mpigi. That's where we are right now, and this is where we have done the research. I also wanted to just give you a brief where we are in terms of our operation since the project started. The formative phase, which basically was looking and trying to understand the nature and form of gender and social norms as they apply to unpaid care, has already been completed in the 4 districts, and it was disseminated, and a number of you attended. This was specifically very important as it was to inform the baseline that we are going to hear the findings today. So it was also conducted, and today we are going to listen to the findings from that phase of our study. We also have the phase of really trying out interventions. The interventions have been set up in all the districts, and the training was conducted, led by Care Uganda, and working closely with the entire team. So these interventions, as we speak today, are ongoing in the different districts. It's an early phase, but we still have a year to complete, to watch, monitor, and observe the interventions. The stakeholder engagement. This is one of them. And we've been doing it during the formative dissemination and other ways. But we believe that this is going to be intensified, and we need to intensify this process so that we reach out to all of you and others to make sure that we can strengthen the uptake but also the impact, because as you heard from all the speakers right now, we're not doing this research for the sake of it. We want to shift, we want a change. We are on this project to contribute to a change in an aspect that we believe has held women from accessing or enjoying the opportunities of unpaid care, or opportunities of paid work, where they could advance their career, but also gainful employment that is stable. The end line, that one will be the last phase, and for sure, we'll invite you once that is done. And then we'll also, I think, be sharing many other things, strategies of engagement, and how we have engaged and how we are working together on issues that will have emerged. We are very hopeful, and we want to believe that we will contribute to a shift. I told you that we did the formative and disseminated. Those of you who are around, those are the few things that emerged out of the formative, and some of them you're going to hear in the baseline. But surely the word I want to say here, that unpaid care work is accepted, is normalized, for women. And that one we need to look at it carefully and shift. The gender norms related to unpaid care are broadly linked to women and men's identity. And there are also variations, but also increasingly women especially have learned to accommodate unpaid care work in workplaces. I think we have a project which IDRS is also supporting, where women are coming in with the children and also cooking food in the markets in order to accommodate the unpaid care work. So when they are going back in the evening, they go back with cooked food and maybe prepared sauce. So that's what we call accommodating. So I don't want to preempt many other things, but these are some of the key things that really also helped us in shaping the baseline and to make sure we're asking the questions that relate to a number of issues. So now I would like to stop here and let you listen to the baseline findings. Once again, thank you very much. We're definitely going to reach out to you to support us, to support ourselves and you as Ugandans, as people who are interested in development, that this agenda on unpaid care is recognized by policymakers, by all the people that are involved in the development agenda, so that we can improve on the lives and situation of women and men in our countries and in our spaces. Thank you so much once again for coming and joining us at this event. Thank you.
Thank you so much, Professor. Another round of applause. So now we know where we are. And formative study is done to identify the norms. And I'm privileged to announce and recognize the presence of Professor Bukuruch here. Formative study grew one of the KPIs. Please stand up to be seen. Thank you very much, Professor Bukuruch Paul, one of the KPIs. We are going to have a very short break, and I hope you have been noting our questions. We have a whole 1 hour to really go deep into the discussion. So we're going to have a very brief break with a breakfast or a break tea, break coffee for about 20 minutes. To make life easy, you'll pick and get back to your seat or be comfortable, provided we are back on our seats in the next 20 minutes. That will be about, let me look for the correct watch. We resume about 10 minutes past 10. So thank you very much. Do we need any guidance on the tea, coffee? We just go for on this table, I guess. And we serve ourselves, get back to our seats, or feel free to network. Thank you so much.
Someone swept your heart away. From that look on your face, I see it's true. So tell me all about it. Tell me about the plans you're making. Oh, tell me one thing more before I go. Tell me, how am I supposed to live without you? Now that I've been loving you so long, how am I supposed to live without you?
I know just how to whisper, and I know just how to cry. I know just where to find the answers, and I know just how to lie. I know just how to fake it, and I know just how to scheme. I know just when to face the truth, and then I know just when to breathe. And I know just where to touch you, and I know just what you prove. I know when to pull you closer, and I know when to let you lose. And I know the night is fading, and I know the time's gonna fly. And I'm never gonna tell you everything I'm gonna tell you, but I know I'm gonna give it a try. And I know the roads to reaches, and I know the ways to fade. I know the rules, and I know how to break them, and I'll always know the name of the game. But I don't know how to leave you, and I never let you fall. And I don't know how you do it, making love out of nothing at all. 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 Hey. Every time I see all the rays of the sun, I'm streaming through the waves in your hair. And every star's in the sky is taking aim in your eyes like a spotlight. The beating of my heart is a drum, and it's lost, and it's looking for the rhythm like you. You can take the darkness from the pit of the night and turn into a beacon burning endlessly bright. I gotta follow it, 'cause everything I know, well, it's nothing till I get it to you. I can make you run and stumble, I can make you find out dark, and I can make every time blow the sound of your wings, or I can make all the stadiums rock, and I can make a night forever, or I can make it disappear by the dawn, and I can make you every promise that has ever been made, and I can make all your demons be gone. But I'm never gonna make it without you. Do you really wanna see me crawl? And I'm never gonna make it like you do, making love out of nothing at all. 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 ما تخلي حد يدمر مجهود الليالي خلينا نعيش فرحة نجاحك يا غالي أحلامك بين يديك تربيهم في العالي وفرح وغني
My boy, let's go to Umu. I know the joke when I say I don't suffer. When the matter they boss in my dada. For this economy I be baller. For this matter I me be the baba. Everything I do when I designer. Head to toe everything designer. Tell me say this is my girl do not find it. Teacher tell me say I no go reach top floor. I eventually become someone. I make them they dance to the ding dong dong. I make them they dance to the big non-stop. And smiling to the bank for the cheese, for the cheese. Now everybody wanna pick, wanna pick. Oh, the sexy ladies wanna link, wanna link. Oh, the sexy ladies wanna link, wanna link. Anywhere where we enter, I shut down. Anything where I give them a job now. It's the grace of God, no be us now.
Ay boy, let's go doom. Aslali so tycoon. Tani mali bengagu. Funi mali bengagu. Chulaga na ikok. Hey, balaga na ingos. Hey, dalangi bachalangi posa. Bona, namnya konta. Chuluga na ikok. Hey, balaga na ingos. Hey, dalangi bachalangi posa. Bona, namnya konta. Chuluga na ikok. Hey, balaga na ingos. Hey, dalangi bachalangi posa.
Once again, good morning, and I hope most of us have got something for break tea, break coffee. Those of you who took coffee, I'm grateful because I received some money in my pocket, but also those who took tea, some people will also receive some money. So there's no problem. Very welcome back. Those who are still serving, no problem. Take it easy. I'm just alerting us that we are starting shortly, so that we try to be efficient on time. We've tried to do so far, and thank you very much for your cooperation on that one, because usually that is a major issue. Dr. Madina, I guess you are, almost there because you're going to be our next presenter. Let me take this opportunity to again welcome those of us who joined us when we had already done the introductions, those who are still coming in all your capacities. For those I cannot mention names, my apology. For those I know, let me recognize Hope Jemima, who is a member of the steering committee of this project. Hope is from the Private Sector Foundation. Could you please wave for recognition, Hope, wherever you are? Okay, thank you. Welcome, Hope. Feel at home. We have other members here of the steering committee, so welcome. I think it's time now to pick information from the baseline. We had the start of this project, the inception meetings, the formative studies which identified the particular gender social norms that are critical on unpaid care work. We have set up the intervention, but before we even hear about intervention probably in our next convergence, let's hear about the baseline. What is it that we are starting with, such that if we have the opportunity to finish this project, we are able to look back and say, this is what has worked, this is what has not worked, and this is what we can carry forward. Let me therefore introduce our next speaker, Dr. Madina Golora, who is a Senior Research Fellow at the Economic Policy Research Center. Join me in welcoming Dr. Madina. Welcome.
I'm hoping those online will still listen in as we speak. And good morning once again. All protocol observed. And I will try as much as possible to speak slowly. because I'm saying it in advance because I try to speak too fast. It's just it's natural for me to speak too fast, but I'm going to try as much as possible to take it slowly because we are going to be looking around with figures. Before I start, I would like to recognize two gentlemen. There were three gentlemen before. Regan is there. This is Regan Mugume. Then we have Medad Kakuru. Those two gentlemen are also part of the team. You know, in the front face of us, the PIs, we have ants. You know what I mean, the ants. So to make it look good on ground, these gentlemen did the whole clear work of selecting the households. But you know what to do next, so you guide, but they do the biggest bit of it in terms of listing the homes, in terms of looking out to help make systems work very well, even for the interventions we are having. So thank you, Medad and Regan, and they are still part of the team in terms of doing the analysis. So what I'm going to present today is just a work that we hope, again, when you come back, you're going to see if whatever we are presenting either has changed or it has not changed. Because what we are trying to do is the business unusual. You know, there is this rhetoric around unpaid care work, gender and social norms. We speak the same issues. But what we want to do is what's different that we can bring on board. How can we test that? Whatever we're going to do will create change. So that's the level of innovativeness of this project. That we are trying to put people in a lab scientifically, and then you put in some medicine called interventions to see what works for them, or if they will improve, or they will not improve, or something will shift. And that's the simplicity within which I can explain this project. So now you have the PowerPoint in front of you. That's just the outline. Just a precursor. Gender and social norms, there's a really tricycle around unpaid care, gender, and social norms. It's something that is together. They really move together. When you talk about unpaid care, gender is somewhere in the back of your mind. When you talk about unpaid care, social norms are behind our minds. So you find that most of the time when you talk about this, what's driving the other are issues around how you understand and how you perceive the gender norms. And you see in Uganda, like most of the other countries, the distribution of unpaid care between men and women continue to manifest itself. And before I go into the details of the actual definitions of what we mean by social norms, I would like my colleague, Paul, Professor Paul Bukuluchi, you know, he's a guy, but he really knows these issues around unpaid care. You know, usually we manifest itself in terms of our mindset that we think it's us women who understand. But Paul is going to throw light on this, what we mean by unpaid and social gender norms in particular. What are gender and social norms?
Thank you very much, my sister Madina, for acknowledging that men also have a mindset of positive masculinities and femininities, rather than the hegemonic masculinity and hegemonic femininities. So this is much appreciated. So when it comes to gender and social norms, so social norms are informal rules that regulate our behavior. They are not written. In most cases, they are unwritten, but they influence even how we legislate. And I see my friend Florence is here. They even affect how we legislate in Parliament. Which laws we pass, which policies we pass, and those we don't. So, and when it comes to gender, these are informal rules that regulate relationships between men and women, including power relations, access to resources, decision-making, and gender roles. Who does what? Who is an ideal man? Who is an ideal woman? Who is an ideal boy? Who is an ideal girl? So they are infused into what we do. And even unconsciously we follow them without even thinking, because that is how we have been socialized. And these gender and social norms come with the sanctions. if you don't behave according to the expectations in your society, in a certain group, in your home, you might be sanctioned negatively, either stigmatized or called a witch or labeled all sorts of things or excluded from communion. So without going into so much detail, to leave enough time for Dr. Medina to go through the issues, social and gender norms are part of us. They're extremely important, and in this context, they regulate what men and women do in given societies, and they are relative from one place to another. Thank you so much, Dr. Medina.
I think, thank you, Paul. It was worthwhile. I think Paul has made it very easy. We all understand what they are. Informal. They are informal things that go into our minds. It's not written anywhere. That probably the girl child will look after the young kids. It's just there. It's not written anywhere. So in the formal sense, people have gone ahead to actually put this down. The social norms are actually informal rules and shared social expectations that shape attitudes and behaviors of persons. And I think that's what Paul has just talked about, the informality. Then what are the gender norms? These are also, again, recall, social norms. It's included there. Gender norms are also social norms that relate specifically to gender differences. And a common gender norm, for example, is that women and girls will and should do the majority of domestic work. So you can see the intricacy between a gender norm that brings in a social norm. So then what we have today here around unpaid care and how it comes in, we look at unpaid care as all unpaid services provided within a home for all its members, including care of persons, housework, and voluntary community work. So I think we are together. So now when you bring all this together, you can even see what it means by being unpaid, something which has no money, and care is basically what's necessary for you to maintain your well-being. And of course work, which involves issues around mental and physical efforts, and sometimes costly in terms of time and resources. So, I have a bit of a cough. But so when you put together work, which is unpaid, that means it has no cost related to it. Are we together? So, in this regard, the SGDs that my friend Grace is here, she's from UN Women. It underscores the need to address the negative gender and social norms that continue to derail women and girls in the world of work. So we find that there is a lot of evidence, at least on the role of gender and social norms, in all allocation of work. And so we find that the bit of evidence which is available is not empirical in terms of tested. So that's what we are here to do, provide that kind of evidence in terms of testing the issue around gender and social norms in relation to unpaid care using the power model. And basically, and as I come to you, Madanda, be ready. So now the biggest baseline in terms of our objectives for this survey, of the baseline report we are having, related to what my colleague, Professor Grace, talked about, we needed to provide data, a baseline data. That means information giving the status quo around the gender and social norms that we are seeing, such that when we go back to putting these interventions, you can measure that for sure what you did created a change. And that's why we're here for the innovativeness. Everyone can talk about social gender norms, but how can we change them for the positive aspect to it? Recall, not all gender social norms are negative. Some of them really shape us for the positive. So then we needed to measure more accurately the extent and division of care work in households and the gender and social norms that are related to unpaid care work among men, women, boys and girls. So basically one of the issues also around the baseline was to guide on the appropriate strategy for implementing the power model interventions at the intervention phase. So in this case, in terms of where should we go in implementing the power interventions. That's the theory of change. I would not like to dwell too much about it, but again, at the end of the day, when you do an intervention, you have to have a foresight of where we want to go. So what we want to see, especially around here, here, and the outcomes, is unpaid care actually being recognized within the homes? Men and boys actually observing in terms of prioritizing social norms related to unpaid care. And lastly, ensuring that communities actually observe and prioritize social norms related to unpaid care. And lastly, to ensure that our policy actors actually put this into consideration in the debates they usually hold. So what approach did we take? Professor did talk about that. And we're trying now today presenting the second part of the approach. In terms of, we did go to those districts, Palisam, Pidgin, Mbarara, and Nasindi. And for those who are not there, at the time when we launched this project, to select this project, these districts, you have to ensure that within what they call the SIGI index. Professor, what is SIGI? Professor Florence, what SIGI? Is it social SIGI index in full? Social institutions and gender index. You get it? So now, based on that social institutions and gender index, the districts that ranked part of the worst in performance, plus the poverty rates being high, were part of the criteria we used to randomly select these districts. So that's the scientific aspect to it. It's not something we did out of the blue. Then within those districts, we selected 4 parishes because there are several, within a sub-county, there are like around 6 parishes. So within each sub-county, we would choose only 1 parish. And there is a reason why. Because we are doing lab experiments, we have to ensure that whoever is in this parish cannot be able to access information from the next parish. So we would only select 1 parish per sub-county, ensuring that the distance is well taken care of, because recall, they are in an experiment. You know what I mean? So an experiment, to ensure that no one knows what you're doing, you have to make sure the information flow is really limited. So we find within each of these districts, we chose 4 parishes, ensuring that they are very distant to each other, such that they can be part of our experiments in terms of labs. That's what we would call them. So then within each of the homes we visited, my colleagues listed, the criteria was the household must be a couple, a man and a woman, at least with some children. Because there's no way we would observe unpaid care norms when there is no 2 genders involved. So now in terms of that, what the other criteria was, of course the woman was the entry point. The woman must have been belonging to at least some form of a VSLA. That's a village saving and loan associations group, or a farm association, such that, and those women, when we come to select them, they must be married women, because we recall some of the VSLAs have single women. But the criteria was, you have to be in a VSLA, and you have to be a married woman. So from within that criteria, we start tracking the women where they belong within these parishes. So the other methods we employed, beyond the quantitative and the qualitative, to talk about this tool of qualitative, we used an Oxfam tool that is well tested internationally on how they pick gender and social norms. But this tool, wherever they applied it in all the other countries, they've never tested it in a scientific way. So we are hoping that part of what we are going to bring on board is to test using the tool that Oxfam developed, modified it a bit to pick the scientific component of how we can shift gender and social norms. So we had 1,431 households that we are using and following within the interventions that have complete information. Recall we had around 1,600 something households, but you know when you go for field work, some people are not willing to participate, or you get the woman and the man refuses because he's in Kampala and he does not want to participate. So where the couple, one of the couples refused to participate, then we would actually, it's supposed to be voluntary, were removed from the analysis. So all these are homes that are couple homes. So the other bit on the qualitative within this survey, while the formative did a sweeping aspect around gender and social norms, within the baseline, we also had to go to these same communities and speak to them in terms of what they perceive on issues around gender and social norms. So around 25 focus group discussions were conducted that are well presented in the gender sense, and 31 key informant interviews were conducted with very esteemed colleagues here, Paul and Florence and Professor. So now the interventions are going to take on this RCT design which I talked about. It's like sitting in a room and then we start doing something around in a scientific way, where we have 4 arms of treatment that I'm going to request Madanda to talk about. I know Professor stressed it, but trust me, if you hear it from the expert, he's going to break it down for you much easily. Because the moment you understand this, it's going to be much easier for us to go through the results. But recall, this categorization was not done before we went for the baseline. We just picked information, then when it came in, we randomly selected the parishes to which parish is going to be in a treatment group and which parish is going to be in a control group. So there is nothing that was pre-selected before we went into the baseline survey. So this is something that was done after, when we're doing some bit of analysis. So, my Madanda, I want you to put it in the simplest way possible, what each of these issues around the power model actually involve.
Okay, thank you very much, Madina. Perhaps you switch off that one. I guess I'm just explaining what power means, power model means. As you may have noted, this is a consortium of researchers, advocates, and implementers, those who are on the ground. So CARE comes in as an implementer of something that needs to be tested. And then we have the researchers from the economic point of view, and then from the academic point of view. So what we are testing in this case is what we call the power model. So the word power there, each letter stands for something. Okay, briefly, the power model has been used by CARE International, where you work, in the Great Lakes region to fight gender-based violence, and it has been very effective. And so we said that, okay, can this model be adapted for unpaid care work? And why unpaid care work? As you know, those of us who are in this area, all of you, I'm sure, in this area of gender work, we have made progress, but progress is slow. We're actually getting frustrated, although not giving up, isn't it? Yes, just use one example, political participation of women globally. If you take Uganda, Rwanda, you think we are doing very well. Because Uganda, we have 34% women in parliament, 45% women in the cabinet. Globally, 20%, in some countries almost near 0%. So the change is slow. So what is the problem? We think, in practice, that the problem is the underlying driver, which is social gender norms that need to shift. And one good indicator of this is the unpaid care work. You are a vice chancellor of a university. Once you enter your gate, your vice chancellorship ends and you must begin the unpaid care work. Otherwise, you know what happens. So we CARE started using the power model. And the power, this is what power in the simplest terms means, the power model. It means that to make a change, an effective change, you need to have interventions that target the individual all the way to policy level. That's the summary of it. Have interventions that target the individual, the household where the individual is, the community where the individual lives, and then engage the policy actors. So there are about 5 different steps. So P includes interventions that will increase the income of the person. And in this model, we chose the Village Savings and Loans Association as a way of mobilizing resources and then improving the incomes of the individual women and men. And the question is, if you increase that income, can it reduce, for example, the unpaid care work. In other words, does a richer woman do less than a poorer one, and vice versa? Okay? But then we know that that's not enough. Having money can cause you problems. Your husband might beat you more. Okay? So, increasing income is good, but not enough. Therefore, you must deal with the household to create a conducive household environment. Again, we've tested that. And so, if in terms of gender-based violence, but we're also testing it now in terms of unpaid care work. So here, we are using, there are various models there, but we are using what we call engaging men and boys model. So we have interventions that try to shift the attitude and the thinking and the behavior of men and boys so that they can cooperate with the women and the girls to reduce the unpaid care work. That's the second assumption. That you make interventions at the individual, which is the P, in this case economic empowerment, and then you shift the thinking of the members of the household through engaging men and boys model. So we're testing that as well. Number 3, we know that you, the family, you can say for us you are going to be very equal, but then the community, your clan members can call a family meeting and say, your wife, this woman is oppressing our son. Even without the knowledge of the son, by the way, and permission. They don't need a permission. Say, you're oppressing our son, you are not married here to make our son work the way you are making him to work. Okay? So therefore, the third intervention is to do with the community. So here we deal with the clan systems, the family systems, the religious institutions, to make sure that the community environment is supportive. And then we know, and I'm glad the Honorable Florence is here, and Medina said it, that the informal also influences the formal. So some of our laws carry the informal behavior and they go into law, into systems, into organized institutions. So the policies at local government level, at national level, at international level can do the opposite. And so the third intervention is to do what we call local activism. So you do advocacy to engage the local duty bearers, like local government, LC1, etc. So that if there is something like a fight on unpaid care work and is reported to the LC1, they take appropriate action, or to a religious leader or whoever. And then the last one, which is R, deals with the national level advocacy and, if possible, international, to shift in UN Women. I know you call that normative environment. Okay, so you deal with the normative environment, the international policy level, so that now you can tap into the national resources and so on. Now, the key question, and I'm going to end, in this is, do you need a combination of all those interventions, or can one of them work effectively? Okay, or a combination of 2 or 3. So in terms of the interventions, we are trying to test out those ones. In some villages, we are testing out only individual and household. In others, we are testing out the whole power model. In others, we are testing out like community and policy issues. And at the end of it all, we should be able, hopefully, to answer the question, does this model work better as a whole? Or which components are the best in terms of shifting gender norms, or perhaps it does not work at all. Thank you so much.
Thank you, Madanda. I think we are now together. So I think he has done it so well, I could not stop you, because you've also explained what that is.
You cannot stop the chair.
So now when we talk about T0 is where we didn't go at all. So we have 4 parishes that are in that group. We have 4 parishes that are actually receiving the full model, also 4 parishes receiving half of the model, and also the other 4 parishes receiving the upper part of the model. But now it's not necessarily in one district. Each district has a representation of each parts of these models. So such that we see where it works well. Is it location? That matters. Is it the different norms that actually come in these different districts? Thank you, Madanda, for that. So now, the key results we are going to present. First, before you do anything, the way the baseline is important is you have to make sure that
At the end line, we are comparing apples and apples. You get it? Not apples and oranges. So right now, these results you're going to see here up, if they are not the same across all these treatments, then there's something we have to look out for at the end line, or control for. So the moment we have different persons with different education levels across these different districts, within these different treatments, then something we need to be addressing or ensure we look out for. So in terms of demographics, so where you see the T note, if it was possible, Madana would have put it somewhere. That is where we are not doing anything. In actual sense, it's where probably you don't need to have done anything. People could change themselves over time. Then where you see what they call the treatment one, is where we have the full model. That's where it's going to be implemented in these respective parishes. Then the T2 is where we have the PO, that's at the VSLA level, and for the boys and girls. That's what, yeah. Then the T3 is where we have the policy aspects of it, and the SASA, and the community. So now, when we take our baseline work, we look out that where you see the yellows, those are the problems. Where you see no color, that's very good. That's very good outcomes. That's the simplicity within it, which I can tell you. So now when you see around the issues around the district level, we can also say probably the problem on an MPG and the PALISA, around where the treatments are, between where there is where we're not going to have any information, and there where we're going to have the full power model. That's where we are actually going to look out for with them in terms of the changes in issues. Then you look at the age of women, age of women, boys, girls. This is consistent within all districts, and this is a good issue. That means we're dealing with similar characteristics of women within similar age groups. Then we look at the sex. It's good to show that even within the gender component, they are similar within this age group, within these genders. So this literally shows that the balance at district level, whether it's somewhat problematic, there is a good indication that when we start comparing women by their age, and we see the differences, then we're going to be on the right track. In terms of the gender, we're also going to be on the right track. So this is what the baseline is telling us. That now the interventions we are going to put in place are dealing with persons that are similar in characteristics. So when it comes to the education level, I try to simplify this. Again, these are the means. But probably what we can look at the means in terms of, the means might not help much, but when you look at the end at the yellows, in terms of women, we are dealing with women in all these treatment groups, women who have no education. These are similar. In all these groups, we have women who are not educated. Even within men, we have men who are also not educated, and these are similar within all these parishes we're going to be targeting. Such that it's very critical for us to see that we have less yellows and more aspects that are not yellow. Implying we are dealing with a category of people that have similar education levels. That means you understand in a slightly similar way. Such that, again, when we come and interview you, education level, if it mattered, it will be seen in this sense. Are we together? So what we are saying is, we are trying to establish that you people are similar. That's what the baseline is trying to tell you. When I come to give you the interventions talked about, it should be something that because it's us who did this, not because something else existed within your communities. So now coming down to the key outcome variables that we are going to be monitoring at the end line, there are two issues that are usually well known. That's time use and issues around the perceptions that my colleague Paul talks about very well, that shape our societies, informal rules. So at the end of the day, when you look at these informal rules, they shape how time is spent on what you do within homes or communities. So that's why we need to see that at the beginning, what was it like? Such that the interventions that my colleague Madan is talking about, if they are well implemented, probably shall see it in the differences within which time is distributed between the genders. So what is the time at the baseline telling us? That for paid work, men have, on average, more time in 24 hours a day. They spend it around 7 hours on paid work, while women spend around 5.5 hours on paid work, and boys and girls, of course, less. That means we are having child labor. This is what for me it means. You know, there are certain young kids who are working. So that's what it is entirely telling you. When we look at the issue of unpaid care work here, then you see the reverse happens a bit. Men spend in their 24 hours, around 3.5 hours on unpaid care work. Women, almost 6 hours. Boys and girls, also the differences are established. And these are around the informal rules that he talked about. So that's why you can see the difference. But what we are all sure of, we all spend the highest amount of our time in 24 hours on leisure. And what does this mean? That leisure includes sleeping. You get it? That's why it is that high. That almost 16 to 17 hours, especially for these young boys, are spent in either playing, you're sleeping, in leisure parks. But whereas, and women, if you compare it with their men, they spend less time on leisure compared to the men. The men's almost coming to 16, 15. The women's less than 14. That means the little leisure time you have, probably you're resting and not necessarily going to the park to enjoy. And sometimes some of you men think us taking the kids to the leisure park is we are spending it on leisure. You're still doing unpaid care. So it's not actually included. So now to see how these parishes perform at the baseline, we are comfortable that for the leisure time, we are almost looking the same. For those parishes that actually are going to receive any treatment, the parishes that are also not going to receive any treatment, we're spending equal time without any differences on leisure time. Then when it comes to issues of paid work, it's where the issues come in, especially for women. We see some bit of differences in terms of where we are going to go and test. And we hope that after our interventions, there will be some bit of differences in terms of looking at controlling for these issues around those who are not looking similar. So we find that, for example, women in the PO group and women who are not going to receive any treatment, the issues around paid care work are not the same. That's what it's meaning. Then the women who are going to receive the full power model, and the women who are going to be just in communities where there's going to be just policy engagement and community cohesion, there are also a bit of the differences between which they spend their time on paid care. That's what it's meaning. Then when we come now to see issues around care work, we find that women within the control parishes and women that are going to be in the full power model have also differences within which they spend their time on unpaid care. That's what it's meaning. So, but we think that this is not an issue because sometimes it's brought about just a few, probably more numbers within these districts that mention these aspects. So we can actually look out for some of these issues when we go to these parishes, when we are conducting our interventions with our partners. So the remaining aspects of where we spend our time on other activities, we are almost the same in terms of how you engage in your communities, on church activities, mosque activities, going to the schools. It seems these are similar within all the parishes that we are going to visit. So we hope at least that's a good one, that we are going to be comparing also again apples and apples for issues around unpaid care on other activities and also leisure activities. Thank you. So what do we see on issues around norms and perceptions? Are they similar across these places we're going to visit? To make you understand, because as Professor said, these are well understood in terms of the 4 R's. That's for you to deal with the gender and social norms. You have to first of all, as a community, as an individual, or as a home, recognize them, that they exist within you, and that taking care of a child looking after the household is part of unpaid care. That's you recognizing it, that's there. In terms of reduction, in terms of the issues that are around you that are going to help you reduce this unpaid care, and you should actually know what's going to support you. And in terms of how you're going to redistribute it within the genders or within the communities, and how does it be represented within, again, the home and the communities. So I'm hoping that the next slides will throw light on how these parishes are faring at the baseline. So in terms of recognition, we had a question that said, who contributes more to household-specific welfare activities? So in case someone does not actually recognize themselves, then definitely there's a problem. So these are the issues around where women fare. Imagine women themselves. These are responses given by women. That in actions on education, she contributes less. It's her husband. On food, it's probably almost on equal ground, yeah, though women come out a bit more. Then on medical bills, you can see. So the issue of recognition around certain things can be manifesting themselves also along gender lines. So in fact, on average, women actually indicate that their husbands or other men contribute more. Recognize this, that they recognize that their men contribute more on certain aspects of welfare compared to themselves. So you can imagine that these, they think of them in terms of monetary aspects. If they had brought in issues of unpaid aspects, probably to be different. But you see the same issue by the men. When you ask them this, they said it's true, they do contribute more. So they recognize themselves as the highest contributors to their homes. And this matched around in terms of most of these issues. So another issue which that homes were recognizing, the women and the men recognizing independently, recall we're asking the men separately and the women separately. So these are level of thoughts that each sex gave. But you can see some of the similarities. Which is the most, in terms of domestic care work, that is the most problematic in your home. They have to have recognized it to see if they understand, to support it. So the women did indicate that water collection and fuel collection, they were all in tandem, both the man and the woman, that these are the most problematic things in their whole households. And the second one, the third one being issues related to caring for children. So we see a level of recognition of around, sorry, unpaid care work within the household. So, when you look at the issues of qualitative and the group discussions, these actually support what we found empirically, that the division of care work is associated with your gender and identity, and domestic care work is banned on the women and the girls, and also men require more strength. In case you look at these issues we saw, splitting wood, washing, it will be more men, they say they require it, as we shall see. So one of the people said, basically women do the cooking, cleaning, sweeping, home issues around, taking care of the children. So they do recognize some of these things, as you realize. But we also saw that even where there are no families with girls, this is one of the issues they found, that boys actually did work in that work which was perceived to be women's work, such as cooking. So really, then women, the boys can also try, or the male gender can do the same things we do. In terms of reduction, reduction is usually seen in terms of those things that support you to reduce more time spent on doing activities that unpaid care, that are not paid for. So we looked at it in terms, when you lump this out, in terms of the asset index of ownership. The good news is all our parishes are the same in terms of the assets they own within their homes to reduce unpaid care. So though these differences were rising with which kind of asset we are talking about. So now, at least what we are happy for is when we are comparing issues around assets, ownership, on those issues that are going to support homes, to reduce unpaid care, we are comparing really people who look the same. So the aspects that are actually different are things that are contributing to around water reservoirs that are different from within homes, the water tap on the compound. Then when you look at the fuel and energy, we have issues around those who actually own access. And then differences also came on battery ownership. But generators, it seems they don't all have generators anyway, all the charcoal efficient stoves that they have. So again, these are persons in terms of homes that are similar in terms of fuel ownership and usage. So the same happens with preparation, the kind of equipment they have to help them reduce that time. And in terms of also clothing, someone will say, what's the suitcase for in helping you reduce unpaid care? Because again, in the day when you have well-stored things, it reduces your time for where you're looking out for your clothes. So that is all times of measurement of time. So whatever time you spend, less, the better. So when we talk about infrastructure, this is critical. You look at the issue around the communities, issues around use of the facility, health facility. The time they spent with these health facilities being the same within these communities, the parishes we're targeting, with just few differences arising on the time they take to walk to there, or the time they spend in terms of using the improved water source they have. So probably this difference here within the communities that are going to be having the full power model, and the community with just the policy engagement and community, probably the improved water sources might be a bit different within these communities. Then when you look at the distances of these services, they are similar. So implying at the end of the day, we're dealing with communities that are actually similar in terms of access to government level resources. Because recall, government will say they do contribute to reducing unpaid care. And this is the way they look at it, in terms of bringing services closer. But you'll see that now in terms of the most common one is the use of the child care, which is really uncommon in terms of these issues we have. So we need to see that probably in case there are some more issues within government provision of unpaid care, this can improve. But for now, almost all communities look the same in terms of the use of unpaid care issues. So on this issue, our colleagues, the qualitative results actually also reveal that there are actually few services in these communities. Here you find that one of the aspects that our colleague, a key labor officer and the CDO for Masindi, they did say, in the district they have tried to make sure that every village has a water source. And they have wells, boreholes, issues around water trust, doing some bit of work, and also in partnership with the districts in order to identify these areas of need. So there is some bit of that. So I think that's why we are seeing some bit of effort, but they also recognize that electricity is also not available. There was also energy saving stoves, but not everywhere that the program has started. So you find that some of these issues are probably related to why we are seeing some bit of differences in the intervention districts for the interventions we are going to do, because in some programs are doing some aspects around that. So in our end line, we have to make sure we control for some of these interventions that are actually being received by some of these districts. So in terms of the second last R on redistribution, now on redistribution, we have to make sure that our people within these parishes distributing care work equally within themselves. So what we see is that for sure it is looking similar, and in terms of distribution within these communities, care work in terms of the way they perceive the norms and perceptions around these gender norms is similar. Both the men and the women. So we are going to be looking at people who think alike in relation to gender and social norms, beyond the women who are within the power group and the control group. In terms of the division of activities, as you can see, when you see the control, so the colors might be a little too much, but you can see the responses here in terms of the various activities around those domestic care activities. So why we're calling it around distribution, if division of domestic care activities is well done, that means being well represented within the homes. And we find that it's similar In terms of who does what, water collection, in terms of who does fuel collection, both men and women revealed similar issues around how they distribute care work within their homes. In terms of behavior, I hope you have your PowerPoint. I can see some part of the presentation can be cut off. So here we find that at least both men and women did agree that care work activities are a woman's responsibility. So even you find yourself agree that it's my job. So in case you don't change the mindset of a woman as well, because at the end of the day, she's believing that this care responsibility is hers. And this, we found it in all of them. Both the men and women did mention that the issues around caring for people, caring for children, the green, you can see it's almost the same, rhyming around, that this is something that a woman must do. So and then, in terms of what our colleagues found in terms of the qualitative, we found that for sure that the unequal distribution of care work was largely attributed to the cultural beliefs and or religious beliefs. So Shay, you can see that. It came out clearly that our cultural beliefs have really contributed a lot to the unequal distribution of care work, because many people in our communities still believe in those traditional cultural ways of domestic work being a woman's task and not a man. So even we can look at this Munyankole person, what they said, who's a religious leader. The Munyankole believe that that a woman stays home and does the work at home. In fact, when a man marries a woman, that works outside home, people believe that that home will be broken and will expect the woman to sit at home and do the unpaid care. So you can see what the community already thinks of you, in case you shift outside what you are expected to do. And lastly, in terms of the last R, what we picked, if these are the same, it's an issue around representation. What do we talk about representation? So in here, we sought to measure this in terms of the strength of those existing norms. Behavior, what does a man and man do? If it's well distributed and you're well represented. The attitudes towards this. The empirical expectations, these are like stories. What does someone expect of you within the communities? Say that, oh, if so-and-so did this, then we do not expect it here. So in our community, a man must do this and a woman must do this. These are what they call the empirical expectations of persons. Then we have what they call the normatives. What women and men believe, others think they do. You get it? So there is a difference between these two. What a men and men believe others do, and what the others also believe they should do. So there is those issues what people expect you to do, to live and behave. In your slides, on your paper, these are separated. This is what the women indicated. We asked people, so what tasks should a woman do, or a woman does better than a man? So you recall, here you see most of them said, yes, there are very many tasks that a woman does better naturally than a man. All of them say the same thing. And they are the same. Even when you asked a man, he also said this, over 90%, almost 100, said it's true. There are tasks that I, a man, do better than a woman. So you can see this is the attitude, an attitude issue already. So when you look at these issues, meal preparation, a woman, even both men and women said it's the woman does better. Issues around harvesting of crops, cleaning the house, again a woman, both agree. And then the issues around washing clothes, they also agree that a woman does better. And you can see these are attitudes, and these attitudes are similar. Even the women and men all believe issues around carpentry, issues around, construction and repair, then issues around farm activities and animals. Both men and believe their attitude are, that's for men. So you can see, unless that mindset and about your attitude towards certain things change, then definitely we cannot do much, because it's an attitude aspect, that someone does this better than me. So when we looked at issues that, we have to ask people, are you satisfied with the issues are done within your home? Then you represent yourselves within these homes. Again, we are happy to see that, at least for now, all the places we are going to visit, people are similar in terms of the way they think. This is, when we asked this, I hope you can see it, satisfaction with the division of domestic and care work. Whereas they are similar, but you can see women generally are not satisfied. They're very unsatisfied with the way the domestic care work is being divided within homes compared to the men. And whereas both of them say satisfied, there's a laxity in terms of those who are satisfied. So that means women are less satisfied with it is divided. So men, you're dealing with disgruntled women, but they're not speaking. That's what we are trying to tell you. They don't speaking either because they fear, and then either being ridiculed by their in-laws, that as my professor talked about. They are fearing, they say, we did not marry our son for him to do this. So just know there are people who are dissatisfied. And because we ask people individually, they were speaking the truth. So in terms of, we ask the women, if domestic care issues around domestic care would do more, in terms of domestic and a woman, what would you want to do around controlling more? So most women said they would like actually to control issues around decisions about their own health. It seems there's a bit of also control of men over women's health. They thought they wanted to be empowered to make those decisions. Decisions around how many children they should have. At first we used to think women decide the children, but it seems that's not the issue. There is a cultural issue around it that I can say it here, that in case you do not give birth to more than the children we actually thought you need, then you are just actually coming to eat our food and fill the toilet. That's what someone said. So please remove all those children that we married you for. So that's the issue. The women said they needed to have some decisions over how many children they need to have. And decision on how they spend their own time was also something that came out. And similar across these parishes we're going to see. So the differences are, so we're going to be comparing apples with apples in terms of these persons, in terms of how they want to spend their time and how satisfied they are with the current division of work. So we hope by after the intervention, these will actually change. In terms of how the empirical normative aspects here, we find that you can see how it is. The women said this, the men say the same thing. That they do approve that few men in the community were undertaking care work. Thank you. About to finish. And also they do say that at the same time, few people actually did say that men should do care work and domestic work. So you can see what people actually expect of you. Both men and women perceived this to be true. That few men do it, and few men will actually say that they do that work. In terms of how many of the respondents actually painted these stories that they were actually true, it was around almost 50% say that this is women's work. It's true. Why they say those stories are true? It's because that's women's work. And this is how the situation has always been in their communities. At least around 30% of men said, because that's the way things are in their community. If they acted differently, there will be probably a carrot and stick. Then men do not know how to do care work. Are you sure you don't know? Or you just want to pretend you don't know? That way you don't do it. So there's that bit. So men are supposed to look for money to support their families. So it seems also there is that response that probably people said that a man's role is more in terms of governing and looking for money compared to the women. So those are attitudes that are actually ingrained within ourselves. So this is the second last slide probably. To paint some of these pictures that we see, that's why these stories are true. Someone in Bunyoro said, basically women do the cooking, cleaning, sweeping, usually done, and sweeping is done by the children, and usually probably the girl child. And the man does the work that brings in the money and fees. Then when you see someone in Palisa, the youth said, just imagine you find your father with a mingling stick cooking. Kalo, local millet. It is very funny. It doesn't make sense. That is what we have grown up seeing. We are meant to believe that some work is meant for girls. So recall, this is a mindset. It's something someone has grown up seeing. So how do you change that? Then if another one said in Palisa that if need arises, a man can do it. It also depends on the home where you grew up from. Many people have grown up in homes where there are only boys. You'll just have to sit and not sweep. Of course, you have to do something. It doesn't make sense. For us at our home, we had just 2 girls. But by the time we were growing up, they were too young to do anything. That means they had to do it. We mingled, swept the compound. So again, at the end of the day, some people are thrown into situations that they are forced to do it. But I think if circumstances change, they would not do them. That's the whole point. And lastly, there are people who feel if a man entered the kitchen and began cooking, he now gets another name. They say he is there to count the pieces of meat and interfere with a woman's work. So the kitchen is a no-go area for men, but you can do other work for, like picking firewood, sweeping, compound fairing, whatever it is. Simon, I think this is shocking to you, but for sure, Simon, from you and women, here you are called bewitched. It's different from your places whereby you do equal roles. That's caused probably by design. That probably your countries are too expensive to get some maids, so you try to divide it up. So what do we take away from here? That now, where you saw the yellows were few, that for sure we're going to be comparing apples and apples to a larger extent. That these communities are the same in the way they do activities. So most of the indicators, have you seen, are not very significant at all, implying if I go and did my power model, any change on the way people think and the way it is translated into the time they spend, it will be because of what we have done. So that's what we need to be happy about for now. So now, in terms of where you see some of these significant differences exist, the yellows, we are going to try to ensure we control for these, probably those programs you saw coming up, like the cooking stoves that we saw in Barara district. We saw some programs that probably CARE is doing, but to try to make sure that where we are going, CARE is not existing. But probably other NGOs exist. So we have to kind of control for some of those aspects, such that when we see any differences, it's attributed to what we are doing and not anyone else's. So again, as you can see, our colleagues from UBOS, norms are something that we need to continuously measure as they keep changing, and they are very slow. So now what we have to see and also encourage is, ladies and gentlemen, now that we have done randomization very well, and now the different models have commenced. We did this, we started in July, June. We started in June, July. We are going to monitor this for the next 1 year with support systems from the institutions to ensure that they are doing the right thing, and we measure that the measurement is really critical and it was really through our efforts to see how these communities are changing given the issues around unpaid care. So we hope we shall come back again here. If that time use you've seen here today has changed for the better, or it's an equal issue, or the perceptions have also changed, that now for sure it is not bad for me to involve myself in the kitchen. But sometimes the women, they chase their husbands out of the kitchen because they say, this is my domain. So how can also change these women? That even these men want to support you. So this is part of the model that we are going to implement, to change mindsets on both sides, to see that this is for the betterment of the family. Ladies and gentlemen, I do submit, and all questions that are going to come are to the team.
And because of that, to ourselves. Okay, that's the NGO treatment. Now, thank you very much, Dr. Medina. Thank you very much. And I love the speakers this morning, especially for time management. I hope you have also enjoyed that. But despite that, they are not slaves of time. They are giving us the substance. I hope we all learned a lot. Personally, I really learned a lot. This is the time now for us to talk. We have 1.5 hours. We should use it well. We have people online. I hope the digital control, you will be able to bring those questions, and also if there are comments. just to suggest that when you have an opportunity, please don't go beyond 2 minutes maximum. And if you see me frowning, you know you've gone beyond 2 minutes. So we'll also request that, you know, there are a few people I may call on, and if there's nothing barring you from speaking, please do so. We want to hear, you know, we are talking about individual interventions, community interventions, dealing with the institutions. You've seen all these, you know, the different ways that the reduction, the recognition, the representation, and the distribution of unpaid care work is being affected. We have all these kinds of things. So we'll take about 4 or 5 questions, comments, and if there is any need for response, we allow some response and proceed like that. So who wants to go first? Okay. There is Agnes, yes. And then there's a gentleman here, then 3, then 4. And then I'll come to Honorable here. 5. Okay.
Thank you so much, our presenters, for an excellent presentation. I just wanted to comment about the way we communicate about the unpaid care. Because I kept on asking myself, is unpaid care work good? Is it useful? Does it benefit all of us? So I think that should be the starting point in terms of the way we communicate about unpaid care, the benefits of unpaid care in terms of social and economic stability, okay? Because when we communicate it like that, it will reduce resistance and backlash. So we want to introduce an atmosphere where both men and women, policymakers, all stakeholders appreciate that actually unpaid care cannot be done away with. But how do we relate and benefit as men and women from this? Then I wanted also to talk about a bit of the policy intervention, giving an example of Norway. If you look at the approach Norway took for, of course I believe in the multi-sector approach in terms of addressing the unpaid care, but the approach Norway took was to create policy incentives that attract men and boys to participate willingly in this work. Much of it is because of the way men and women or boys and girls are socialized. So it goes back to the socialization within our homesteads. If that socialization bit change and boys and girls grow up knowing that this work is good for me, it's good for you, I think they will find it easy to redistribute but also share it out. Otherwise, I really believe that policy interventions are key in terms of attracting boys and girls to be part of this. Examples in hotels, I always say that in most hotels, the chefs are men. And they do it willingly and they enjoy it. They enjoy the cooking, they enjoy the washing of dishes, because there is a reward at the end of the month, there is a paycheck. So in that way, you find that, and I can mention so many other activities that men do it willingly because there is a paycheck at the end of the month. So if we take the path of policy interventions and also socialization within the households, we will have to get a breakthrough. Thank you so much.
Thank you very much. Agnes, 2 issues there. How do we communicate? And what are the policy incentives? And gentleman from Alumat?
Yeah, Almas.
Almas, yes, Almas. Thank you.
Yeah, thank you very much for all these elaborate presentations that we have had. My question, you talked about where you did the study in all the 4 districts. We saw the Western Uganda being represented, Central being represented, and part of the East, but none that we have heard from the northern part. And we have seen that gender issues on that side. what were the limitations that you do not include the northern part? Was these 4 districts give us the real picture of the representation of the entire country? And then also we see, even in refugee settlements, we have had a lot of issues concerning gender. You have plans, maybe if you are doing your inline, to consider all of that? And then also, secondly, Dr. Medina, as you were presenting, we saw a lot of similarities in all of these. When it comes to data localization and dissemination, how do we do it? Because we have the civil societies that can actually reach these individuals in their respective villages. What plans do you have to ensure that this data can reach at these civil societies at the low levels, so that this information can be heard, not to repeat the same in a final, the baseline? And also can include the local governments. However much that we need policy up, but we also need these people to know their roles and responsibilities. Thank you very much.
Thank you very much for that. How shall we disseminate and how do we choose? There was number 3. Yes, welcome. And then number 4 and number 5.
Thank you, Professor Grace. Thank you, Dr. Medina, for the informative baseline study. My name is Lydia Nakato and I work with Uganda Women's Network. I'm happy that unpaid care and domestic work is becoming a song, just like last week we had Nyegi Nyegi. I see people have started picking up interest in unpaid care and domestic work. Just my colleague raised a question why they are not considering districts in northern Uganda. UNET, we are implementing a project on unpaid care and domestic work, and we are in Kampala and Gulu district. I feel if other organizations come on board to implement the unpaid care and domestic work, still they will go to other different districts other than those ones that we do implement that project, to increase on the number or the sample of the districts that we implement that project. I'm happy to see the results that the 4 areas are being followed in the different districts that have been selected. However, there is a 5th R that is coming up on board. Different countries have started putting it in practice, the reward, that at the end of the day, what benefit are you giving to someone who is taking care of doing the unpaid care and domestic work at home. In the room here, I'm very happy to find that at least 50% they are male represented. Most cases when we talk about gender issues, we are only women. But this time around, I see almost 51% they are men. And we really appreciate for that. And we are taking you to be our male champions for the unpaid care and domestic work. Let that discussion not stop here, but circulate it even in your homes. Make that care work, the unpaid care, be a practice. That's the only way we can change our minds with even the little boys that we do have at home. Unless otherwise, the mindset will not change. It starts with us, the people in the room, going forward. Thank you so much.
Thank you very much, Lydia, for that input. And I hope that you've got enough champions here through that advocacy. There was number 4? Yeah. Yes. And please, if there's anybody online, alert me so that they make their contribution as well. Please move forward.
Good morning or good afternoon, members. My name is Hope Jemima Kasimbazi. I am the assistant manager at Private Sector Foundation Uganda, in charge of gender equality, women in business, outreach and partnership coordinator. I'm so excited to be here. I'm also a member of the steering committee of the GROW project, and I would like to congratulate Dr. Grace, or Professor Grace, with her team, and Dr. Sewanyana for the achievement received so far. I started with them. I know how they have been struggling, sleepless nights, so the results are now beginning to come out. I'm so excited to be part of this. I have a small observation. We need to highlight, when it comes to unpaid care work, we need to highlight the intangibility of the work that we do. We spend most of the time, especially women, running in and out, but that work is never valued. So I request that we highlight the intangibility of the unpaid care work. Thank you so much.
Thank you very much, Jemima, from the Private Sector Foundation, one of the members of our steering team. We will take two more, then we get a few responses, and then take another set. Okay, please.
Thank you so much. Dr. Rebecca is my name, from Private Sector Foundation Uganda. I want to applaud the team for the milestone. The first quick comment is I sit in the equity and inclusion space, and so from the beginning of the presentation on selection of the selection criteria, I noted with interest the fact that the homes we're selecting were those homes with children, but also homes with married women and no single mothers. And I know for studies like this, you always, and the fact that you're doing RCT, you're always very particular for purposes of consistency. But I just observe that it may be an exclusion point that for the future and as we do interventions that we want to address. Because I was reading actually the UBOS household survey of 2019-20, and there's quite a lot of information around single mothers in this country. The second point I'd like to raise, I think the one on reward, and that relates to what Agnes talked about. One of the things that may actually help us, and because we're dealing with social norms, we don't want to be seen as fighting communities, is promoting the 5th R. That where there's all this recognition being done, the redistribution, in cases where we still have the women involved, can we, as part of our advocacy and interventions, can we have appropriate reward and remuneration so that that is seen as being supportive of the part of the practices? In terms of title, I don't know if I missed anything. Do you have any interventions being done at workplace level? From the presentation, I picked more at families, to be interesting to hear that. And then lastly, I read through the statistics. It's very commendable job, definitely. And I would like to recognize that Professor Bukurich was my teacher on research methods at the university. So I know what he taught me and that I also try to practice. Particularly the norms and perception index on redistribution. Attaining such uniformity is magical, and I think it's worth noting on my end. Thank you.
Thank you very much, Dr. Rebecca, for that intervention. Finally, in this, we'll pick the second round. Is it okay to conclude with the Honorable here, then we pick the next round? Sorry? Yes, but you have something to contribute. Or should we pick the other one first, Honorable? I thought you have something to contribute. Welcome, Honorable Florence, to say something about the discussion at hand.
Okay. Thank you, moderator. Dr. Asimwe Florence Akiki, Woman MP, Masin District. I'm going to talk from the legislative angle. First and foremost, I wish to thank the team for this wonderful work, the evidence-based research, and I'm sure that the data that we have just been shown we inform the policy and the laws that we, the MPs, tend to come out with. As you are aware, our laws and policies are based on research. Without proper data, it becomes difficult to come up with a law that is convenient or convincing to address a particular problem. So one question that you'd want to put, I'm sure, before me, what are the laws that Parliament has come up with to address the unpaid care? This research, hopefully, at the end of it all, we should come up with areas that need to be addressed in terms of legislation. We have already looked at the amendment of the succession law. I'm sure most of you are aware that we recently amended the succession law, and the focus here is on the family, and indeed this research was on the family, looking at the children, looking at the wife and the husband. So the succession law has been amended, and this cuts across urban and rural, because it has been noticed that women's work has not been recognized. If, for example, your husband dies, the clan comes up and says, please go away. This is our son's property. You didn't contribute anything. But I think now the law is very clear. We need to get versed with it, that even sometimes women also have some money. They are also rich. We also have rich women. They are saying that also men should also share from what you acquired in marriage. So this study, I was asking Grace whether we also looked at the urban area or it was more on rural, but most of she told me it was a mix. So when you are looking at unpaid care, we look at the context in rural and urban. It becomes easier for an urban person where you have gas, you have got electricity, somebody could be able to prepare himself a cup of tea very quickly, than in the rural area where you have to go and make a sigiri. You have a charcoal stove, you have to use firewood. So we need to, I think, specifically look at those aspects. So specifically here, I'm talking about legislation. Come out with issues that you think we should put in the law. There are a number of laws that we have in Uganda on gender. We have the marriage bill. We have got the succession. We have got the Children Act. We have got so many laws. So we need to come out with particular aspects that you think are missing in these laws, so that we amend them where necessary, and where they don't exist, we have come up with particular laws. So as a legislature, we need to come up with the proper legislation. Of course, there are some things that you cannot legislate, like the mindset change, the culture. As politicians, we need to just go out and talk about these things on radios mainly, on rallies, funerals, wherever, where we are given a chance. We talk about them, because we cannot legislate some of the issues that are coming out here. But where we can legislate, this team should come up and bring out these things, and I'm ready to take them to Parliament. We are talking of 39%. As you are aware, we have the parish development model, which is now being introduced by government. And this parish development model is strictly looking at the household. And we are saying a family can be given 1 million And that million can make a big change in the family where the children will be involved. If, for example, you are rearing chicken, there's water to be given to the chicken. The man will also be involved. The woman will also be involved. So the parish development model should also be looked at. How it is going to impact on the family. How are these actors involved in these enterprises? Agriculture, animal husbandry, and also fishing. So the government is saying let the family be involved, let all the people be involved, because at the end of the day, this 1 million should be able to improve on the income of the household. So that is a policy in place. There is a PDM policy, and government has come up with many policies that try to address the family to ensure that there's less disparity between a man and a woman. We are aware that indeed the women have been overstressed, they have been overworked, but I think there is some change that's coming up, and men and women, as we continue to make awareness raising on radios, in rallies, the new generation of men and women should be able to change the attitude. Another issue that is coming up is we have focused so much on a girl child, on women, forgetting the boy child. I think that issue has also to be addressed. That is it true that is only a girl child who is suffering? At the end of the day, we are leaving the boy child like an orphan. The other day, as a member of gender committee, we visited remand homes. We found out the majority of the children who have gone against the law are boys. And the question was, why? Why? So the boy child, I think we will have to also change the focus and look at the boys as well. So I don't want to take a lot of time. All in all, what I'm saying, that this data that comes out, bring out key issues that you need to be put in the law. Then I'll forward, since I belong to the gender committee or to the house, I can always take as a private, either it can be a private member's bill that we can put on the floor of parliament, or it can be through cabinet, because laws come through two ways. Some come through cabinet, some come through private members' bill. So once those ones are out, we are ready to go. Thanks so much, and thanks for coming, and thank you, the research team, and more research is needed so that we get the right policies, the right laws that help our people. I submit.
Thank you so much, Honorable. Thanks so much, Honorable, for that. We have an open invitation if you have legislative proposals, and we have our own here who sits on the appropriate committee. Allow me to give one more contributor from the Ministry of Gender. We are talking policy, we are talking laws, we are talking implementation, we are talking advocacy to make a contribution. And then I invite some of the presenters to respond on a few questions, but most of the things that you have seen or heard are comments. I'll then also pick some comments from online. So Hajara from the Ministry of Gender, please take the floor. Feel free to introduce yourself because people could have forgotten. Thank you.
Thank you very much. My name is Hajat Hajara Naluvega. I'm a senior culture officer in the Department of Culture and Family Affairs in the Ministry of Gender, Labor and Social Development. I want to thank my Honorable Member of Parliament for that contribution towards the policy framework at hand. And I want to add to the discussion that as a ministry in charge of the people, right from the child to the youth to the women to the older persons and the rest, the employment, the laborers, and everyone in this country. We have a lot of policy framework in place, but like we have all observed, probably a lot of these policies have not directly been addressing the issues of unpaid care work. But however, some of these policies are below, under review, and we have the opportunity to include some provisions and take care of the unpaid care work. The first policy that I want to bring on table is our national gender policy that is under review, and there is room for us to look at the gender balance of work in the households to ensure that we have that equity. We have the Employment Act of 2006 that is also under review, and like we said, we have not been targeting to look at the unpaid care work because by the definition of an employee, it is that person that is receiving remuneration, and at the moment, probably some of those categories have not been catered for under these policy frameworks. We have the employment regulations of 2011 that are focusing on supporting women to balance between productive and reproductive roles in their workplaces and families. We have also, we are also developing the breastfeeding regulations at workplaces, and these are for both government and other employers who are employing mothers that are breastfeeding and are supposed to find breastfeeding spaces for the employees that are mothers to ensure that they have space to breastfeed their children, have them safe at some corners or spaces, and then have some flexible working hours for the mothers. We also have the male engagement strategy in the same ministry, and we think this strategy is out to balance between work by men and women, but also targeting the males to ensure that they engage in some of this domestic work where we think a lot has been left to the women. We also have the Uganda National Culture Policy 2006 that is also under review. We have clearly said that the cultural norms are enshrined in people's cultures, and we also know very well that culture is dynamic. And so we are reviewing this policy to ensure that we address some of these gaps that are being identified. We are also drafting the national family policy. Ladies and gentlemen, we have all observed that a lot has gone unaddressed at family level, and we think once we address them as early as the family level, then by the time they reach the employment up here, a number of gaps will have been covered. We also have the national parenting guidelines in place, where as good practices of parenting, we encourage hard work for both boys and girls within the families. We're also developing the national parenting manual for all practitioners who are in the work of parenting, so that a lot of those norms are handled at that level. There are gender norms, there are social norms where they think some work is specifically meant for males and not for females, as has already been put in place. Ladies and gentlemen, we also observe that the older persons do a lot of unpaid care work. Many of our grandchildren are usually left with their grandparents in the families, and those older persons usually are not paid to do that work. So we are also reviewing a lot of framework around there, and this it has been noted. We think we have the opportunity to address some of these issues that have come out of this research. I want to thank the team that has been out in the field carrying out this research, and promise to take what has been observed for the ministry to ensure that we encompass it in our policies that are specifically under review. Thank you very much. I submit.
Thank you very much. Thank you very much, Hajara, for that voice from the ministry, and especially the invitation to input into the ongoing policy review processes. For me, it's very exciting to hear those opportunities that are on the table, And I think it is up to us to come up with concrete proposals. Allow me to get back to the few questions, then we shall open the second round. Sheikh, I hope you can just pause a bit. I want to invite any of the team members to respond to a few questions. I hope you took note. But there were issues about selection criteria. Why Northern Uganda is not there? Why refugees were left out? I think Professor Grace and Dr. Medina can compliment on that, and any member of the team. There is the issue of equity and inclusion, which was raised, especially with regard to single, maybe female-headed households, or even single male-headed households. Why those not part of the sample? And if at all there is anything to say about interventions at the workplace, and Professor Paul and any of us could respond. We begin with Grace. Pick whatever, and then we'll go to Medina, and any of the other members is free to contribute. Medina first? Okay, Medina first.
Actions, which we cannot come up with right now at the onset, because this is an experiment we want to do to see what works and what does not work, for us to take it up.